Hello there, my name's Luke and I'm the lecturer for critical care at the University of Hull. And before I go any further, I'd like to say thank you and congratulations. First of all, thank you for spending a few minutes of your time to click and watch this video just now, and in doing so, agreeing to give a little of your time to support one of your colleagues on the critical care unit. And congratulations for being seen by your colleague, probably many of your colleagues, as being somebody who is approachable. We all know that asking for help can be one of the most difficult things, especially when everybody's been under pressure, as we have for some time, you have for some time. So you're clearly somebody that your colleague values as being approachable, and clearly somebody that they trust, and somebody that is seen as knowledgeable, to the point where they can help develop and help progress one of their colleagues to improve their skills and knowledge on the critical care unit. So thank you and congratulations. I'm going to talk through a few things. And first of all, I'm going to talk through what is this thing that's being shoved under your nose by your lovely, well-meaning colleague, what you can do to help them, and also what support is available. Okay, so first things first, what is this? What is this thing? Okay, it's the Step 1 competency booklet rather, but what on earth is it? So these things have been around for a few years. The most recent version of it is from 2015. It's currently being looked at again. And if you've been around a little while, like I have, you might have in the past done something called Foundations in Critical Care, which many people would have done sort of 10, 15 years ago if they were working on ICU. It may be that you're completely unfamiliar with this, and it's a group of competency statements, a group of things, standards that we would expect somebody in, say, their first year, coming towards the end of their first year of critical care, to have developed both knowledge and skills and attitudes. And it's a standardised document that's used widely certainly throughout England and other parts of the UK, so that we've got a common language. And if somebody has completed their Step 1 in London or Hull or Lincolnshire or Manchester, then we know that we can expect certain standards of that nurse or of that healthcare professional. Excuse me. But it's a group of several competencies. They're arranged mainly by organ system, although some of them cover things, activities that you would expect a critical care nurse to undertake. So assisting with a patient transfer, or end-of-life care, or detailing accurate documentation, for instance. And the Step 1 competency, Step 1 level, is aimed at nurses ideally within their first year of working on the critical care unit. So maybe that's somebody who is brand new qualified and critical care is their first job, or somebody who has gained some experience elsewhere in surgery or medicine or wherever and has recently moved to critical care. And so they are new starter within the intensive care or high dependency unit, or integrated critical care unit, if that's the area that you're working on. And so what should happen, what we hope would happen, is that when a new person joins your team, your critical care team, having not worked in intensive care before, they receive one of these books and get started immediately at sort of trying to work their way through, and it sort of signposts and guides them to the sort of knowledge and skills that they'll need to develop in that first year. So that's what the Step 2 document is. Now, what do you need to do? What have you been asked to do by your colleague? Well, I suspect they'll have approached you and said, would you mind signing us some stuff for me? And the first thing to say is that they need to be quite specific about what they'd like for you to do. Okay, they might come to you with a particular page or a particular area of their practice that they'd like you to have a think about, that they'd like you to assess. It may be that you've spent a shift together recently or a few shifts together recently. You've looked after a particular patient or group of patients, and from that experience, you can gauge their level of competence and whether you're happy to put your signature to the step 2 document. So that leads us on to thinking about competence. What is competence? What does that mean? Well, there's a definition within the step 1 and all the step guidebooks and I'll read it to you just now. Competence is the combination of skills, knowledge and attitudes, values and technical abilities that underpin safe and effective critical care, nursing care and interventions. Now, I think we'd all agree with that, but what does that mean? What does that mean in a practical sense? Well, you'll remember just a minute or so ago, I mentioned that this was aimed at nurses in their first year, or roughly their first year, of working within the critical care environment. So we're judging that level of competence against somebody coming towards the end of their first year, somebody who is a decent nurse, somebody who you trust after being on the unit for a year, somebody who perhaps could look after a relatively straightforward level 3 patient or a couple of level 2s if they had supervision nearby. So say you, the experienced nurse, was in the next bed space, or there was some local supervision, and you could trust that person to care for a patient and their loved ones, and if they spotted a deterioration, then they would know when to seek help and any sort of early management. We're not judging competence by the level of somebody who's been qualified for 5 years or an ICU consultant or anything like that. We're judging them at the level of somebody that's been qualified for about a year, is doing a decent job, can look after your fairly regular level 3 patient or a couple of level 2s. So for instance, within the competency book, you might be asked to help sign off or assess somebody's competence at looking at arterial blood gases. And so we might expect for them to be able to explain what a metabolic acidosis was or alkalosis. What if a blood gas has some compensation occurring, and they should be able to spot that. They might be thinking about any changes they might suggest in terms of ventilator settings and that kind of thing. We're not assessing somebody's competence at the level of thinking about things like anion gaps or any sort of prescribing decisions or anything like that. Okay, I think a guiding principle might be: do I trust this person's skills? Do I trust this person's knowledge sufficiently that when I go on my break, they could look after that person by themselves for a period of time, and if there were any deterioration, they would recognise it appropriately and seek senior help. I think that's the level of competency that we're talking about. So how are you going to assess? How are you going to assess the competency now we've established the level? Well, the main, and it says within this document as well, the main means of assessment will be observation. Working with somebody, working alongside somebody, seeing what they do, seeing how they go about things, maybe having a chat with them about it. That's the vast majority of this document. That's how it should be assessed. You might find their lead assessor, and that'll be somebody perhaps who has their mentorship qualification, more likely than not a band 6 nurse, or certainly somebody very senior within the team, more likely than not a clinical nurse educator, may get that nurse to do some other activities, do some reading, to do a workbook, something like that. But for you to assess an individual competency, observing their practice, maybe asking them a couple of questions, I would argue is sufficient to be able to sign off. But what happens if you're unsure? What do you do if you're unsure? Well, I think the first thing is to say that that's an entirely reasonable thought. I think you could ask your colleague a few questions, check their knowledge, check what they're check what they're able to do, check what they're able to tell you. Again, thinking that they've got to be at that level of a good nurse that's been qualified for about a year. You could say, well, I'm not confident to sign this on this day, and offer them some feedback. I think you need to look at this. I think you need a bit more practice with this. You might offer to work with that person in a few weeks, or if you're on shift again, sometimes so you say, oh, we'll bring your STEP competency book that day and we'll have another look at it then. And you can show me what you can do. You may seek advice and guidance from another senior nurse within your area. And the ideal person to go to would be the clinical nurse educator. They will no doubt already be helping in some way to support anybody that's on their step 1, or for that matter, step 2 competency set. And they'll be able to offer you some support. And I think that brings us nicely on where to go if you're unsure. So you can check in with your clinical nurse educator. You can check in with your senior nurses on the unit. I'm going to put a link below here to the Step 1 Competency CC3N website so you can read that. And ultimately, if you're still unsure or if you'd like to discuss this further, you're welcome to get in contact with me. Now, I'm not going to put my email address on YouTube, but you can seek a conversation with me, or you can email me, and my contact details are with the clinical nurse educators, certainly within the local trusts. So Hull University Teaching Hospitals, North Lincolnshire and Goole, they have my contact details, and we'll be able to pursue that further. So I think I'm just going to check. I think that's everything that I wanted to talk to you about today. Once again, thank you very much for spending 10 or so minutes listening to me and having a bit of a think about how you might be able to support your colleague to achieve their Step 2 competencies. Know that it's a good thing that you're doing. Know that we're very grateful. Thank you very much for your time.